guys, welcome back to Meds Made Easy. My name is Tarun Verma. Let's get right to it. Today we're going to talk about Lurasidone, also known as Latuda. It's a second generation antipsychotic. It works for people who have a diagnosis of bipolar depression and schizophrenia. Off-label uses, meaning the FDA has not approved it, but doctors do use it. It's used for major depressive disorder, psychosis that's associated with dementia, so for those reasons as well. Let's see here, dosing is scattered, but so I won't really talk about that. How quickly does it kick in? 1 to 3 hours to hit your peak levels in your body. It generally takes about 7 days for you to hit steady state, which is for your body to get fully saturated with the drug. So, if you don't see an effect in 2 or 3 or 4 or 5 days, you gotta keep going. You gotta go at least a week for it to really hit the right level in your body. So, it has a black box warning. I gotta mention it. With black box warning, I don't know if I ever mentioned these in the videos, but there are severe side effects that if you have them, you need to stop taking them immediately and call your doctor. One is suicidal thoughts on this medication. If the suicidal thoughts go up, you need to call your doctor, let them know. There's also an increased mortality in elderly patients with dementia-related psychosis. It affects a very, very, very small portion of the population, so I'm not really going to go into it. But if you are in the elderly, that is something you have to watch for, or your loved ones who are caring for you need to watch for. Let's see here. It works by antagonizing your dopamine 2 receptors, your alpha adrenergic receptors, certain of your serotonin receptors, and that works by increasing levels of those neurochemicals in your brain because there's an imbalance causing the disease state that you have and the diagnosis that you have. So we need to be able to redistribute those brain chemicals, and that's what this medication does. It does it by dopamine 2, serotonin, HT2, and I believe an HT1A as well, and then your alpha as well. So let's see here, guys. For people that are pregnant, you for sure, I believe, cannot take this medication in your 3rd trimester. For the pregnancy class, I couldn't really find what the pregnancy class was for this. I know it's a newer medication. There haven't been too many studies that have been done, but I know for sure you cannot take this in your 3rd trimester, so you need to make sure that your doctor and you are on the same page about this medication, whether you should be taking it or not. Again, I couldn't find a pregnancy class for this one, which I thought was kind of shocking, but I think for newer medication that it may be normal. There's just not enough evidence or research out there for it. For breast milk, same thing, giant question mark, don't know if you can or not. They just say it's under the supervision of your doctor, so it's up to your doctor's discretion whether you're going to take this or not, or whether you should be taking it or not. So again, make sure that you're in conversation with your doctor about this if you need to, lactate during this medication. If you have moderate to severe renal liver failure, you need to make sure that your doctor knows about this medication because it can interfere with the other ones. And as far as clearance meaning getting it out of your body, you don't want it getting backed up. If too high levels of the medication can lead to a lot of side effects. I'm going to put up a list of side effects right here. Guys, I think that's pretty much everything. It's a pretty straightforward medication to take. It has a less of a side effect profile than like risperidone and some of the other antipsychotics out there, especially the 2nd-gen antipsychotics. Let us know if you have any questions down below. Give us a subscribe. Let us know how we're doing. We just want to help with these videos. That's what they're all about. So guys, thanks for tuning in. We'll see you next time on Meds Made Easy.